Your senior source, sponsored by JenCare Senior Medical Center.
Welcome back. It's a common problem for senior citizens, but how do you deal with arthritis pain? There are many treatment options available, and our next guest is here to break down some of them for us. Please help me welcome back Dr. Reginald Ross from JenCare Senior Medical Center. Hey, Dr. Ross.
What's up, Malik?
Good to be. I'm so glad that you are here, rather. And I'm really passionate about this topic because my mother has arthritis. And I want to ask you, what is the most common type of arthritis in senior citizens? My mother, she's going to hate that I said this, but she is a senior citizen.
Well, I don't know if she's watching, but I certainly won't tell you said that about her. But the most common cause of arthritis in seniors is osteoarthritis. And if I could explain just for a second, what typically happens, the older we get, our joints basically, they just wear down. Sort of like if you have a new car, if you have, 15, 20, 50,000 miles on it, the more miles you put on your car, the more wear and tear on its parts. And the knee joints and the hip joints and basically all your joints act the same way. So the older we get, unfortunately, we've had more wear and tear on our joints. That's why people over 65 or so seem to get it at a higher rate than younger people. However, younger people can also develop osteoarthritis because things can make it the wear and tear happen a little prematurely, such as I was an athlete. I'm quite sure you've played sports at one point or another. If you take injuries to your knee or hip or any joint, certainly the wear and tear can happen a lot sooner. And then we have some adults that unfortunately are a little overweight, and that's adding to the additional wear and tear on their joints.
Well, I appreciate you thinking that I am athletic, Dr. Ross, but I was a orchestra person, so no sports over here. But for people who may feel like they have symptoms, let's go through some of the symptoms. What symptoms should seniors be on the lookout for?
Sure. Some of the most common symptoms you see what we have listed here is certainly swelling in the joints, and tenderness and pain, and particularly when they get up in the morning. A lot of times they'll have an achy, stiffness to their joints that actually gets a little better as the day go on. But they could also have trouble moving their joints, and it can be real dangerous because if their mobility is somewhat impacted, they can increase the falls in elderly people. That's certainly an issue. That's why we have to be really cognizant and vigilant about treating arthritis, because it can lead to a lot of other accidents and things.
And doctor, question for you. Is this something that we start experiencing at age 65, or is this something that we may start experiencing before age 65 that may lead us to possibly getting arthritis?
Sure. Malik, I'm going to make an announcement. Myself, I'm not there yet. I have about 10 more years before I get to 65, and I'm already experiencing it now. I have knee pain constantly, back pain. So it can happen early. And what usually happens, it's not something that happens suddenly. It's a more chronic, slow at first, a little stiffness, but as time go on, you develop more of the other pains and the swelling and things like that. So no, it starts off at an earlier age and just can lead and get a lot worse, unfortunately, the older we get.
But doctor, you're on your feet a long time helping people get over this COVID-19 and making sure we are safe, especially senior citizens. So I understand why you're having a little bit of pain, but thank you for being on your feet all those hours to help us get over this coronavirus because it is still out here. But as far as arthritis, okay, common treatments. I need to know some common treatments. Senior citizens watching out there, listen up. What are some of the common treatments?
Sure. I'm quite sure most people have heard of the what we call RICE treatment: rest, ice, compression, elevation, and it applies to any injury that you may get, but particularly arthritis. It can help there. So if your knee's hurting, kind of rest up, put some ice on it, wrap it with an ACE bandage. That usually helps. And certainly exercise, low impact exercise usually helps. And what's really good too is aqua therapy. So if you get in the pool and do some exercise there, you're taking the strain off your joint. So it really helps if you can find a pool and do some exercises there. Certainly medications also, anti-inflammatory medicines, even Tylenol. And when we talk about anti-inflammatory medicines, it could be something like ibuprofen, Advil. Sometimes it comes in creams and rubs. And BioFreeze is also pretty good for it also. And one of the treatments that my patients told me years ago really worked for her that I don't recommend anybody do was, believe it or not, WD-40. She actually tried that on her knees, and that was something that she just swore by. Never did recommend it, but I just thought that was a little interesting that she actually wouldn't take any other medication except for that.
Hey, because it can be painful, you know. Sometimes you gotta get it wherever you can get it, you know. WD-40, not recommended, but some people will do what it takes. Now, before we go, doctor, real quick, I have to ask you, you know, we're talking about arthritis here. Is there a way to prevent arthritis?
The number one way I think would benefit most people is to really, in this area, obesity is such an issue here in this area, and weight loss would be the number one thing I would say that would certainly help. And to get there, of course, you would do some exercise, which would also help your joints. And just to be mindful that when you are hurting, don't try to push through it. Just kind of take it easy and rest up. It's your body telling you that it needs a break, not to push it any harder.
Some great tips this morning, doctor. My mother is listening. Thank you so much for being here. And hey, for more information about osteoarthritis and other senior healthcare topics, you can call JenCare at 504-323-5700 or check out their website, JenCareMed.com. And you can also check out one of their 4 locations on the West Bank, Mid-City, Metairie, and Kenner. And as you can see, there's a 5th location in Gentilly coming soon.